pressure on me now. All right, start again. So this is the heart, coronary artery, right? Now this is the aortic arc, okay? Now the aortic arc branches into, the first branch is the left subclavian artery. The left subclavian artery is going to come and give blood to the left forelimb, okay? Left forelimb, once it comes into left forelimb, it changes names. So it's subclavian, subclavian. When it hits the shoulder area, it becomes axillary. And when it comes to the outer part, it becomes brachial, okay? Then you have another branch called the brachiocephalic artery, this big branch right here. The brachiocephalic artery branches again into the right subclavian artery, which gives blood to the right side, to the right forelimb, and the carotid trunk. So this is the carotid trunk, this where both of these meet down here, okay? Now the carotid trunk branches again into the carotid arteries, giving blood to the head and throat, okay? Now we have our veins. So these are the left subclavian veins, the right subclavian veins. They're going to come and they're going to join the superior vena cava, this big blue vein, all right? Superior vena cava is bringing back all the blood from the anterior part of the body. Then you have internal jugular, which is giving blood to the throat, and external jugular, which gives blood to the head. Bringing back blood, I'm sorry. So internal jugular vein and external jugular veins are bringing back blood from the head and throat. All right? And that's about it for the posterior part. So we're gonna come down here and you're gonna go back. So if you follow this backwards, you will see this big tube. That is the dorsal aorta. Okay, so the dorsal aorta, and if you follow it, you see this one big blue vein right here, right? This is called the azygous vein, which is bringing back blood from the ribs, okay? Azygous vein. Then we're gonna go down further, and you're gonna really have to look for the other, then we're gonna look for the artery that gives blood, the celiac artery, all right? So here is the celiac artery, this one tube is coming out of the dorsal aorta, and this is one tube, this red one, okay? The celiac artery is giving blood to the liver, the spleen, and the stomach, all right? A little bit further down, this artery is called the anterior mesenteric artery. That is giving blood to the small intestine and the spleen, I think.
Oh.
The duodenum of the small intestine and the spleen, I think.
Pancreas.
The pancreas, not the spleen, the pancreas. Okay? So the anterior mesenteric artery is giving blood to the small intestine and the pancreas. Going further down, we see this. This is the renal artery. This is the renal vein. Okay?
The one that go to the kidney?
Yeah. So one is going and giving blood into the kidney. The other one is bringing back blood from the kidney. The renal vein is going to join the inferior vena cava. All right? So the inferior vena cava is this big blue tube right here. Do you guys see it? Like that huge hue of blue?
Mm-hmm.
Come on. Come on. Nope, that's not it. It's right here. I'll show you that later. Okay? Now we're down to the legs. So the dorsal aorta branches out into the external and internal iliac. All right? So this is the external iliac, right? The external iliac is going to go into the legs, right? The external iliac goes into the legs, and it goes into, it further branches out into a deep femoral, which gives blood to the thigh. So it goes inner and into the femoral, which just is more outer, and it gives blood to the outer, to the foreleg. Okay? The internal iliac goes down and it gives blood to the sacral region, I think. You guys have to look that up, okay? Same goes here, okay? We didn't go down deeper into this side. We just did one leg. So you have the internal iliac, and this is the internal one. And if you dig deeper on this side, you'll find the external one. We just did it on this side, okay? All right, are we good?
Yeah.
All right. So now that you guys have the circulatory system done, do the excretory on your pigs.